Welcome to Emergency Medicine Duo, a show featuring a real emergency medicine doctor and a real emergency medicine nurse. Welcome to a really exciting episode of Dr. Grumpy. We have a new collaborator in the studio, FERN. Welcome to the team.
Thank you. It's great to be here.
So, FERN, that's an interesting name that you've picked. Does it have any special meaning?
Yeah, actually, floor nurses gave it to me. I like to think that it stands for favorite ER nurse.
Oh, I was wondering if it meant fantastic ER nurse.
You know what? That's probably what they meant by it.
Yeah, I don't think there's any reason to look more into that. Without further ado, let's get into The Resident. All right, so the setting is Atlanta. Nice looking hospital.
Oh, yeah. And I know that when I get to work, the first thing I do, take a couple selfies, post them online. That way people know, hero at work.
I mean, that gratification you can get by posting that you are a hero in the healthcare setting, it can't be beat.
Oh, can't be beat. Maybe that discount, though.
Hi. Patient in bed 6 was triaged as acute.
He said his pain was a 10.
Your pain is always rated the lowest priority, basic. Certainly not acute, which means big deal emergency. When is Nurse Hunley back?
Oh, she's at St. John's now. Budget cuts or something. I got your back.
For context here, this is a new nurse in this hospital, a new triage nurse, and she's speaking with one of the ER doctors.
So basically, triage is in control of the flow of the department, trying to figure out which patient is sick, which patient isn't. And it sounds like she brought back a not sick patient to a sick bed, which is a big no-no.
Yeah, it's a really important role. It really dictates where the doctors go most emergently. The triage nurse really sets the tone in the emergency department.
Well, got that encounter out of the way. I'm sure they'll only be better from here.
Yeah, I'm really good at understanding foreshadowing. There's no foreshadowing here. They are going to be an excellent team throughout the rest of this.
Hold on. What department was this again? I got distracted trying to read her hashtags.
There were some pretty good hashtags. I don't know if you could tell by the bright flashing red and blue lights and the really loud siren that every emergency department has. We're actually in the emergency department and they're getting a sick patient.
How could I have forgotten? You know, usually our sirens, they kind of sound something like
Yeah, that's
just
exactly
like
it.
that.
How else are you going to know that sick patients have arrived?
It's all coming back to me now.
Bleeding, possible liver lack, and right-sided pneumothorax.
Acute?
Bus overturned on I-85. Multi-casualties. Ambulances are stacking up outside.
Hey, it's Dr. Hawkins. We need help down here.
Both acute, a trauma bay 2, and a bed 8.
Whoa, can we back it up? Because based on the scattered report I got from that first ambulance, it sounds like maybe there was a mass casualty incident involving a bus.
Yeah, you know, what I'm thinking here is, man, if there was just some sort of device or technology that we could have utilized to have the ambulances talk to the hospital before they got there so that they knew that a whole slew of mass casualty patients were coming to their doorstep. You know, that would have been pretty awesome.
You know, I think I know what you're talking about. It's a telegraph.
Yeah, or smoke signals. I don't know. You just would think that thered be some type of technology. And then the next thing for me, how do you feel about this bag valve mask technique?
Oh, I mean, looking at it, I see that Hollywood must have spent the big bucks training these individuals because never have I ever seen a successful one-handed bag valve mask technique.
Yeah, certainly an advanced technique. I mean, not for the commoners like you and I.
No.
And then the final thing here is, how about that report? Let's back it up just a little bit here and see how it all sounded. Oh, shit. Sorry, I went a little too far back in time there.
But God, those hashtags. Remind me to say something about that later.
That was just a superstar report given by the two of them. You definitely could understand what both of them were saying. We got a 27-year-old man.
Female,
he's got anal beads in his butt. He's got a orbital wall fracture as well. And a collis fracture. Yeah. In all seriousness, I think what they're trying to do here is to illustrate the seemingly chaotic and random nature of the emergency department, but I feel they've taken this a step too far.
I couldn't agree more. To put a nurse on her first day into the triage position just doesn't make any sense. In that role, you need experience, you get oriented to it, and if you're floundering, one of your team members will help you.
Yeah, I think that's one of the most unrealistic things we've seen here is they've put a person in a position where they are going to fail. That is not how an emergency department works. All right, let's get back into the medicine here. I love the power walk from the resident, the way his shoulders are moving. It's arousing. But I think this is the time for them to bicker about staffing.
I mean, are there patients to be seen? Yes. But hospital to complain about? Also yes.
Yeah, the patients can wait, frankly. This mass casualty will figure itself out.
Meanwhile, this nurse doesn't even know how to triage.
I think she's doing a really good job messing everything up.
I mean, hashtag first day on the job, am I
I
right?
wiped out on my skateboard. I wasn't wearing my helmet. My head hurts a little bit. Little road rash.
Okay, a headache, a road rash.
That guy hit his head on his skateboard. I'm just gonna pause this. I'm calling it now. This dude's got a head bleed and he's gonna die. But let's see what happens.
Meanwhile, I'm calling security because he just walked back to the patient area without checking in.
168.
Charge. Clear. Shock. Still no pulse.
Hair acts as an insulator and prevents the shock from getting to the heart, which is the point of the defibrillation. So we remove it, and we reapply directly to the skin.
All right, timeout. I'm calling timeout on this. Let's go back just real quick. What's that rhythm I'm seeing?
I'm seeing asystole.
Remind me again. Is that a shockable rhythm?
No.
So is the most important thing here to rip off this guy's hair and shock him again?
Definitely no.
Oh, so what is the most important thing?
If it were up to me, I would start beating his meat.
Excuse me?
Sorry, grab some gloves and pound on his chest.
Oh, you're talking about high quality CPR.
The one and only.
I'm willing to bet, though, that what they're doing is going to work, right?
Oh, yeah.
Let's check in on that.
Charge. Clear. Shock. Sounds really
There it is.
Hey! All right. Well done.
Where's your ID?
Back to this guy.
Didn't get one. Think I can ask for
Still thinks he's going to be seen after not checking in.
Doctor.
Very important to check into the emergency department, ladies and gentlemen. That's a Dr. Grumpy tip.
Hey.
Utter chaos in the emergency department today, and I think that we could blame this on one person.
Triage nurse. I mean, look at it. It's pandemonium in the ED. You got this guy right here. He's next to the medicine cabinet. Is that an approved place to put a patient?
No, but apparently it is an approved place to save his life.
I've got it.
So she just reduced his shoulder there. In medical school, they do tell you that sometimes less is more. And I think what they mean is don't ask questions and get a history. Don't do a physical exam. Go with your gut.
This isn't mine.
Sleepy time for Skater Boy.
I think that's a good sign.
All he needs is a quick nap, and then he'll be back on the board.
Hey, Irving.
Quick 5 for everybody. Get back at it.
With RVR, I'm giving 10 and Bill Tyson.
Whatever, man. Just do it.
Excuse me, doctor.
Yes,
Excuse
we'll
me.
be right with you, man.
Doctor, please.
Whoa, watch where you're going.
I'm trying to provide some healthcare. Get out of the way, bitch.
Hey, I just promised him a 10-minute nap. Please don't disturb my patient.
All right, so it's pretty obvious this guy's pretty sick. What kind of stuff should they be doing now?
ABCs, interventions, diagnosing, something.
Yeah, there's a lot of priorities right now. Let's see how they do with this.
Get his vitals, start an IV. Let's have the intubation cart standing by. He's unresponsive. Pulse is weak.
Double access wide open fluids, peripheral neo for now. Dr. Okafor, tube him.
On it.
Damn it. Left pupil is blown. Looks like we have a brain bleed. Do we have images?
There's no ID bracelet, so there's no way to know if they're tests.
Is he gonna be okay?
Where's this patient's ID?
Oh,
Has he
I
even been
forgot.
checked in?
I didn't have
Blame,
time.
then ABCs.
Yeah, it's a new format. B ABCs. Blame the triage nurse first, then worry about all that medicine.
His name is Ian Robinson.
Ian, can you hear me?
Can't hear you. My best guess is a subdural hematoma.
bleed must be compressing his
They're
brain.
making some big jumps in logic here, knowing literally
Now, with that
nothing
stance,
about
knowing what
him.
the bleed is, they can't just blindly drill into a brain.
But he's gonna be okay, right? Because he
No, you
said he
killed
just
him,
had a
man.
headache.
Oh,
This is obviously all her fault.
God damn it, if she wouldn't have been posting selfies today, Timmy would still be alive.
It's Ian.
I don't know his name. He doesn't have a name band.
Obviously, this outcome was not ideal.
Yeah, now we're going to get into a really important part of being a team leader, which is debriefing your team. You've got a bunch of people who I think are not going to feel good about the care that they just provided. So you really have to come together, try and learn from it, and kind of figure out next steps. So let's see how they do with that.
Please, no, he can't.
He has no ID bracelet. You didn't even admit him properly. So, we have to learn his name in the middle of a code? Ian. His name is Ian.
I found him. Just lying over there, unattended, in basic.
Why didn't you triage Ian properly?
It's my first day.
Pause. Has anyone ever received feedback that made them feel terrible and then was ultimately effective? Because I haven't.
Yeah, I mean, my opinion on team management: praise in private, criticize in public, make everyone live under fear of you and that you will blame them for every outcome, and you're going to be a pretty great leader. You know what I'm saying?
Yeah, I think that Dr. Dick over here would agree with you.
Yeah, I mean, this is a moment here where obviously he's the team leader. People are looking to him to get them through what is a pretty tough moment, and he's blaming the triage nurse for an awful outcome from a significant injury that was not in anyone's control. He's a dick.
Oh, man.
He had a head injury. That's at minimum urgent, always.
We were so busy. And he seemed okay.
With brain bleeds, there aren't always symptoms at first.
He had a head injury. He should be on concussion protocol in urgent.
The patients, they kept coming. And I didn't want him to be marked as urgent if he was basic.
It's better to be overly cautious with a head injury. Now you know what happens when you aren't. Next time, your patient won't end up like Ian, dying alone in basic.
All right, everyone, let's get back to work.
Someone is dead because of her mistake.
Yeah. And she'll always carry that with her.
Someone cushioned this man's fall because he is on a power trip. Quick recap, this was not the triage nurse's fault. Hard stop.
Yeah, I think a thing just to bring this back for everyone, he diagnosed this kid with a subdural hematoma, which is wrong. He probably died of an epidural hematoma. That's a really significant brain bleed, and the symptoms come on really quickly. So the way that they just portrayed this, he went from not being triaged to dying in like 15 minutes. It doesn't matter how quickly that would have been recognized. He was in a very dangerous spot. Not the nurse's fault. This is just a sad outcome.
He's right. We need to move on and focus on the patients that we can help.
Debrief, fail.
Abdominal pain, bed 2. All you.
This highlights an important part of the emergency department. Even when there's bad outcomes, you gotta go see the next patient.
And speaking of the next patient.
Setting.
Lieutenant, get a glide scope.
Airway.
Oh, no, that's surgery. You can't do that in the ER, not without attending supervision.
By the time someone gets here, he'll be brain dead. Get the trait kit.
Are you sure?
There's no choice.
There is a choice. You can choose to follow protocol.
The patient would die.
I'm not telling that father his son is dead for a second time today.
Don't do this.
Stop! That's normal.
No, it's not.
So you're telling me that if you were the resident in this situation,
Uh-huh.
holding the scalpel, aka the knife,
Yep.
and the attending physician were screaming at you, no, no, no,
Yep.
don't do that.
Yep.
You're saying you would do the procedure?
You mean stab the patient in the neck?
Yeah.
No, I wouldn't.
Wow, so a lot of take-homes from the resident.
I mean, there's certainly a lot to chew on.
I think for me, the thing that sticks out the most is the hashtags.
Oh, who could forget the hashtags? You know, if we had to come up with a hashtag to encapsulate our experience with the resident, what would you use?
I think I have one in mind. It would be concussion protocol.
He should be on concussion protocol.
Oh, so like hashtag a concussion protocol?
Concussion protocol.
He should be on concussion protocol.
I think I have one other hashtag that would work really well.
Oh, yeah.
How about hashtag the resident sucks?
Perfect.
Well, it's been a lot of fun, certainly. Thanks for being here, Fern.
Thank you for having me.
And remember, if you have any suggestions for shows you want the two of us to check out, please leave them below in the comments. Otherwise, we'll see you next time.